Hello everyone, my name is Kosh Dudakia, and this is going to be a brief overview of Long Island Health Hospital. So the objective of LIHH is to provide value-based care for all patients in the Long Island community to increase patient quality, reduce cost, and increase access to patient care. So just as an introduction, a little bit about the hospital, it'll be located in Hillside, New York, which is a small little town in Nassau County. This hospital will be an acute care hospital that also has a rehab department. It will have a geriatrics and palliative care, a psychiatric ward, as well as a department researching into HIV and AIDS. This will be a nonprofit hospital similar to nearby hospitals such as Mount Sinai. The size of this hospital will be, in the beginning, it will be one campus with around 1,000 physicians, 8,000 employees, roughly 700 beds, and 20 operating rooms. Services will include a comprehensive care, including emergency ICU, surgery, laboratories for research, acute post-care stay, a nursing home, infectious disease, as well as a mental health and drug treatment department. So the demographics of Long Island Health will be primarily patients from Nassau and Suffolk County here on Long Island, but it will also include patients from the 5 boroughs of New York. Regarding the payer mix, it will be uh, a mix of Medicare, Medicaid, private insurance, large portion of managed care, and a very small portion of those who will self-pay. Research and analysis was also conducted when looking at Long Island Health Hospital, and we searched two comparable hospitals. One, as I mentioned, was Mount Sinai, and another was New York Presbyterian, two well-known and well-regarded hospitals in the New York area and just well-known throughout the United States. There were three things that we found that we can use when creating Long Island Health Hospital, and that was a heavy research into population health management. That includes a lot of data analytics, understanding the patients, what they need, what works in terms of providing care, what doesn't work. So that would be a key part of Long Island Health Hospital. Number two is the heavy use of technology. And, our plan is to aim to create Long Island Health as one of the more modern hospitals that utilizes technology in every way possible. Finally, it will be conducting a yearly community assessment, understanding what's needed for our patients in the surrounding areas, and adjusting on a year-to-year basis. So these were the three things that we found in common that these two hospitals, Mount Sinai and New York Presbyterian, use, and we plan on using that as well. So financial strategies, being a new hospital, being a nonprofit, a large part of our uh, money will come from donations. And in the beginning, we will also be taking out a fixed rate bonds, which is the safest way to borrow money for a nonprofit hospital, as we'll have a fixed rate when paying back the money. As we start operating, we will be looking at strong cost control and leaner operating management. After year one, we will also be doing an assessment to look at ways to improve revenues of our acute care services. And a large part of our financial money will go into investing into data analytics. As we said, population health management will be key into the success of this hospital. So just a few actions and milestones. In the short term, it will be all about finance and the clinical side. So on the financial side, we'll be, obviously looking to create a value-based plan, which, it's all about quality over quantity. And this will include outlining our population base, understanding what needs are more necessary than others, and focusing our money on those needs. On the clinical side, we will assess the health of the community and find ways to increase engagement throughout the community. So we want people to, trust as a new hospital. We want people to come to us, and we want to show them that, we can provide excellent care. Long-term goals will be all about technology and eventually expansion. So on the technology side, we want to create a universal electronic health record system. And we believe that if we can create a system that puts uh, each medical record in the hands of the patients themselves, it will be safer and it will make patients feel more at ease that they have access to their information, which something uh, is not really doable right now. And the part of the way we can do that is heavy research into blockchain technology, which is one of the ways we can create a universal healthcare system that will not only be safe, but also cost efficient. In regards to expansion, eventually the plan is to create multiple Long Island Health facilities throughout Long Island. And part of that will also include creating existing partnerships with smaller, already existing health facilities. So over time, within 5 years or so, we do plan on having multiple areas, multiple towns in which Long Island Health exist. So in conclusion, Long Island Health Hospital will be a modern healthcare facility that runs on a value-based delivery model. It will serve the community in providing quality care that will work to revolutionize the healthcare industry. So we'll be breaking ground at the end of this year and early 2020 and plan to finish within 2 years, roughly around the end of December 2022. Thank you guys for listening to this presentation.